All right, everybody. Welcome to another live edition of the Leadership Bend Live podcast with your host, Ricardo D. Rice, and my co-host,
Simone Cherie.
All right, so we are back. You know this face. You've seen this face. He already in rare form, so I apologize in advance. Dr. J. Bush, how have you been, sir?
I have been amazing. I've been amazingly well. It's so good to, of course, be back here again. Thank you so much for having me. It's been a very long time. You keep me caged up in the back. So...
In my defense, at least this time, because I think the last time I asked you like at the very last minute, and you griped about it so much, I was like, you know what? At least it's like be a week or two in advance. So I was like, let me ask him now, so I don't have to hear that. I should get credit.
You said a week or two in advance. There was no two involved in there. It was a random message. Hey, we need colors. We need colors
I
over
told
here.
y'all we're gonna apologize in advance. I don't even know what's happening right now. It's fine
been a
though.
lot.
You're here.
We needed
You're here.
articulate Negro to come talk about healthcare.
This in particular, and thoughtful.
All right, well,
thoughtful.
wait, for those that do not know you, tell everybody about you.
Yes.
Well, my name is, I'm Dr. J. Bush. I am a healthcare strategist by trade, college professor, author, speaker. I make a mean potato salad and macaroni and cheese.
Is there marshmallows in your...
No, ain't no marshmallows. Your grandma ain't never had no marshmallows and no raisins in her stuff.
We have to ask these days. Everybody got their own interpretations of potato salad. I just
no.
So make sure yours is the one that's left on the table after everybody ate.
No.
Moving on. I don't have time.
Moving on. Yes.
All right, Simone,
it's a pleasure.
We have so much. We have so much to catch up on. And we have a lot that I think is going to, first of all, help people know a lot more about you, your expertise. We talked about healthcare a lot last time you were here.
Yes,
we definitely need to talk a lot more about healthcare. Yeah, we need to talk a lot more about healthcare.
The only thing you called me for is healthcare. Actually.
But there's a lot. But there's so much going on with this. We have to talk about that. We have to talk about funding cuts. Okay.
Yes,
we have to talk about that. We need to talk about the state of Georgia. We need to talk about public media and cuts to public media, threats to public media right now, free speech. Even forums like this. Then we can talk about some elections and get into whatever else you would like to get into.
All right, so let's just start with the big, beautiful bill. For context, the only reason I call it that because that's clearly not what it is.
Oh, the BBL?
Oh, that is
yes.
True. Yeah,
all right, let's talk about the BBL.
Yeah, so it did pass as much. I don't know. I think it scared me because as much as the tactics the Democrats tried to use, they were just outgunned. So it didn't matter what they did, from holding the vote, being on the floor for hours. It didn't matter what they did. This was going to happen. The only prayer we had was that some of the Republicans would grow a conscience and be like, no, this is just ridiculous. We're not doing it. But of course, that did not happen. So here we are. This bill is passed, and it pretty much, in a nutshell, takes a lot of money from the safety nets of the people and gives it to ICE and other spaces that give him teeth to just do what he wants to do.
Yes. Should we do a quick summary of it? So the bill, it barely passed, but it did pass all the same. So it passed the House. It was 215 to 214. That was the vote count. The Senate, it passed by 51 to 50 after an amendment. So it was a very, very tight passage, but it did pass. There will be impacts for Medicaid, for the ACA, the Affordable Care Act, for food nutrition programs like SNAP, as well as others. So the new law basically increases Medicaid and ACA coverage loss for people who are non-compliant with work requirements. So there'll be eligibility changes.
Which is BS, but go ahead.
It is. We should talk a lot more about work requirements too. There'll also be limits on coverage for certain groups, especially people who are considered non-citizens. It will limit the ability to fund the state's share of Medicaid. So just overall, it's going to decrease federal funding for these programs, period. And you know, if you work in this field, or if you work in a field that provides services like I do, you know, it also just increases the administrative work and the burden that states have to do. These have always been federally run programs, always since their inception. Yes. That's how they were designed. So this is a sweeping change in lots of ways, especially just administratively, basically plopping new work on a local jurisdiction's desk or state jurisdiction's desk that's never had to do it before. So then there's that part, you know.
All the while slashing these things.
While slashing
these things. So it's like, okay, you got new jobs, but there's not 200 of you to do it. There's 50 of you to do it.
No, it's fun times.
It's
good times.
You talked before about access to care too. And I know that we were talking about Georgia, and we've talked before about rural hospitals, I think just broadly. There's also going to be a lot of impacts to that, right? Just to the ability for people to get it's called the Rural Health Transformation Program.
Mhm.
So this is supposed to be established, right? But rural health has been a
That's
challenge and a
BSL,
concern for a long right, for a long
Yes.
time. What's your take on the bill as it is right now, and like
Well,
its impacts on healthcare?
It's laughable. All right. So you've already noted that the big beautiful bill, or the BBL, as I like to call it, big beautiful legislation. So the BBL does make, of course, a substantial cut to Medicaid.
Mhm.
Obviously, Medicaid programs are a big chunk, of course, of the spending for the United States as a safety net. So I got the concept behind them wanting to make cuts somewhere. This is
Mhm.
the biggest part of us making cuts. Trimming the fat in your household. If you're thinking about income and expenditures in your house, do I really need Netflix? Do I really need these things? All right. Typically, when you're doing your own budgeting in your own household,
Mhm.
you stop and you say, my favorite show, Game of Thrones, is on Netflix. May not
Uh-huh.
want to cut that. Let's look at something else that I can cut. All right. That's something that we did not do in this particular instance. We cut Netflix, which also cut our Game of Thrones, which is healthcare. Now, how does this affect those rural hospitals or the community-based facilities? Well, I think previously I talked about access to care and what that means. Each one of these particular facilities has a payer mix. I want you to think about payer mix the same way that you think about the income going into your own household.
Mhm.
So if you have a 2-income household, maybe the mom has two or three jobs. That's her mix
Okay.
of income coming in, and the dad has 2 or 3 jobs, and that's their mix. Sometimes, or in many cases, there's one spouse or one other person who has more income than the other.
Mhm.
That's the state of our healthcare system currently, especially on the statewide.
Got
So
you.
federal government puts up about 68% for the state of Georgia for funding for Medicaid, and then the rest of that is taken up by the actual state. Okay. So that's the state's mix of this, about 60-40, right? 60-30, whatever. Or whatever that percentage is. Math ain't my thing.
I mean, listen, you close
Okay.
enough. I was
Right.
with it.
Now, when it comes to those rural hospitals
Mhm.
or hospitals in general, hospitals have the exact same makeup that we have in our own households. With when you have multiple incomes coming in or multiple streams, you are a case in point in that. You got 7,000 jobs with 7,000 streams.
You tried
coming
it.
in. Right?
You definitely tried it.
It's the truth, though.
You
It's the
definitely tried
truth.
it. Me or you?
All right.
Okay.
Okay. Look at here. Now,
Me or
mine,
you?
yours. Okay. So those facilities also have a payer mix. They have a streams of income.
Mhm.
Most of these are coming from the actual payers themselves. They have government payers and they have commercial payers. So your Aetna, Cignas, your Humanas, et cetera. But then you also have your Peach Care and your Peach State.
Okay.
Those are Medicaid programs. And typically the type of facility that you have, their mix might be a little bit more different than, of course, a rural hospital. Rural hospitals have a tendency to have more of those government payer plans associated with them because of the population. Poor population, they depend on Medicare and Medicaid. So you'll find that maybe a Piedmont or an Emory has a smaller mix of those government payers, maybe 20, 10%, versus that community hospital or a rural hospital that's 2 hours from Metro Atlanta, which probably has 60 or 70%. Now, I want you to imagine that 60, 70% of your income is being affected in your household. That main person or that primary person loses their job. That is going to affect the household. That's what's going to happen to those community-based facilities. They are already struggling because they're in a community that only has a high population of patients who are either on Medicare or Medicaid. Right?
Yeah.
Medicare and Medicaid traditionally reimburses at a very low rate versus the commercial payers that are out there. So as a staff member, because you talked about more jobs being placed on the individuals. That same thing is happening now in those rural communities and those rural facilities, because now that individual who would normally, they're already struggling to make the keep the lights on now because again 60% of their income comes from a place that pays them slow. Medicaid is that cousin who don't like to pay and she pays you back in increments. Medicare and Medicaid, that's how they pay you.
That's right. That's right.
So I want you to think about it in that manner. They already pay the providers slowly, and so now not only are you paying me slowly, there's a chance that you may not pay me at all because the dollars have been truncated.
For context. So when we say they pay less, so let's say like an X-ray costs normally $1,000. Are they charging Medicaid like 800? Like, is that the thought process?
Yes. So this X-ray costs $1,000, and so with maybe the commercial plans, the Aetnas, the big ones that you think of, those commercial plans are probably have negotiated to pay back $950, which is good.
Yeah,
I only have to cover $50, or maybe the patient covers $50. Medicare, Medicaid says, nah, bruh. What that 200 look like? I'm about to give you 200 on it.
It's that big of a cut?
It is a substantial percentage that's different. So not only am I getting shorted on what the procedure costs, I'm also, I have it on the 3rd or the 15th. I don't know. You're gonna get this money when I get this money. Is that how they normally operate? Now, what this bill? Let's go back to the BBL. So now the BBL goes through. It passes narrowly. It then cuts those expenditures. Remember, most states like Georgia has 68% coming from the federal government. So now they're saying we're going to reduce that. We don't know what the reduction is going to be, but we do know that it's going to happen over 10 years. The reduction for this particular state, I should say. That's what we know that it's trillions in reduction. I just don't know what that number factors into the state of Georgia. That reduction happens. Now, what they're saying is your state is supposed to pick up the weight. Our state is not known. Well, most red states are not known to pick up that slack.
No.
Again, I want you to go back to the analogy I used earlier about a two-parent household. Baby, how can I pick up the slack? I work at the Waffle House. What?
It's true. It's true.
You a CEO at a company. You bring home 6 figures.
Yeah.
I bring home $6. What slack? There's no slack to pick up. So you're asking the state to then now pick up the slack for that gap in between. And what's going to happen is those individuals, they're going to make the criteria difficult for individuals to get on. You named, of course, the work requirement that's there. That is a false. That's a red herring that they threw out there to just kind of distract you, because Medicaid and Medicare, Medicaid supports children who can't get a job. These are infants, right? Peach Care is for kids, right? Who's this job requirement for, right? Then there's the disabled. Who is this job requirement for? And so that
it's
who's the job requirement? It's for no one, right?
Yeah. Just to underline that too. So the worst states for healthcare were already, I think some of these have not changed. We're considered Georgia, West Virginia, Mississippi, Oklahoma, Alabama. They're estimating that Georgia will lose $500 million, over $500 million in Medicaid funding, and they will have to close rural hospitals and lose coverage for approximately 1.8 million individuals. So that's over 10% of the population of Georgia. They also said that Georgia is going to be among the most expensive states for healthcare, and they've started doing some analysis to see what this actually means. Let's say you receive ACA or you go through the healthcare exchange. Premiums next year are projected to rise between 20 and 40%.
Oh, good Lord, it's already
on top of whatever already high. It's already high. The affordable care is already questionably affordable, and the premiums are going to go up in Georgia. They said the most as of right now.
And it was only that way because the state refused to fill in that gap. Remember the percentage I talked about. The ACA, once it was passed by Bishop Obama.
Not Bishop Obama.
Yeah, shut up. Glory be to God. Remember those red states refuted. They didn't want, of course, the Affordable Health Care Act. Okay, and so they kept nitpicking at it. And then even in those places where it's supposed to fill in the gap, those states chose not to fill in the gap, thus making it actually expensive for the patient population. Now, if you look at the BBL does have a little ram in the bush of $50 billion. For those rural community facilities. Which is actually it's a trash. It's trash.
You gave me hope and then you took it away. What?
Yes. Okay, because again,
you know what a ram in the bush means, right?
Yes, I do know what it is.
You do know what a ram in the bush is.
Because there ain't no ram in the bush. All right,
but it's something states have to opt into, right? So it's
not only is
given.
it something that a state has to opt into, it is they rely on the fact that the average American doesn't understand dollars or quantities in that amount.
Okay.
When we talk about billions and trillions, obviously it is above our brains. We're like, what are you talking about? Okay, whatever. It's the same thing. It is not the same thing, because you giving me $50 billion when you have taken away trillions of dollars.
Oh yeah, for sure.
So
For
that
sure.
they're relying on the fact that you're not processing. You're like, you saw the number 1.6 trillion, and then you hear the word 50 billion. The number 50 and the number 1 are two different. Your brain thinks, oh, well, we're at least getting money back to the communities. You're not. What they did was they said, hey, I know your that as a community hospital that your allowance was $100 a month. Well, we're going to take that $100, but I'm going to give you $10.
Right.
Wait, is that
To be
are
used
those
in the-
numbers
to be-
actually
that- to be
that's
used-
equivalents?
They're
But to be
taking
used
them-
in this specific way.
Yeah, to be
as
used in
well.
a specific way. Yes, I'm taking away 90% of what I normally give you. I'm going to give you the 10. They turn around and put that little clause in there to give them that additional 10%, which equates to 50 billion over 10 years for the entire United States.
So I'm just imagining, like, if I'm in college and I'm at Emory and I'm studying to be a nurse, or if I have any healthcare career aspirations, am I going to stay in Georgia?
Actually,
Like, really?
that's not the first thing you got to be worried about. Now the thing you got to be worried about, I can't borrow enough to finish my program. That's what you got to worry about now,
Yeah.
because
Or
now they put this cap on
Or
education.
they're
Or if
more than likely going to probably open that up to predatory lenders to
Sure.
to get you because you're going to get the
Sure,
education.
sure.
Think
They'll,
about
But would you
that.
they'll fill
work
the gap
here?
in.
Like, would you work here?
Um,
Why would you?
Well, you probably wouldn't work at a rural facility. You'll probably try to still go for maybe
Emory
the bigger places,
Mm-hmm.
which are still going to suffer too. Because even I know we're talking about the rural facilities, but even our community-based hospitals like the
Yeah.
WellStars and the Emory's, if
Mhm.
you recall, I think the last time we spoke, Atlanta Medical Center closed
Mhm.
down.
Mhm.
Okay, that caused a massive influx because that was a safety net hospital for that particular area.
Mm.
All those patients have to go somewhere.
Yeah.
Now, I want you to also factor in what then happens when I've now removed healthcare from those the population that we
Right.
quoted. They have to people still gonna get sick.
Right.
People
Yeah.
still gonna do
And
stupid
Grady
stuff.
is right now the only the only level 1
Mhm.
trauma. Yeah.
So I still have to go to Grady. And Grady's still going to, because of the Hippocratic Oath, they're still going to perform those services to save your life. They just may not get paid for those said services.
So what's the likelihood of them continuing to do it?
They're going to continue to do it. I mean, that's just a thing. They take an oath. You can still go through the ER, but that's going to then decimate, of course,
Yeah.
the ER wait times, which are already high anyway.
Mhm.
So that's going to decimate the ER wait times. It's going to cause strain on the actual staff. And then, of course, again, I want you to think about the administrative burden now that they've placed on the people who work at these facilities, the
For
WellStars,
sure.
the Grady's,
For sure.
because now it's my responsibility to know. I know someone that got no insurance. Someone that got no insurance. I still got to fix this broken whatever she has and send her on her way. I'm going to attempt to collect bad debt on her. It's not going to happen because Simone don't pay her bills. We don't pay her bills.
We have trips
Right?
to go on.
Okay, she got trips to go on, bundles to buy. So now there's a whole administrative team back at Grady who is fighting hard to figure out where we're going to get this money, what charity's going to step into play in order to make this happen, and that's going to increase more so for those particular individuals too. So for my folks who are in healthcare, they also see where I'm kind of coming from. That reduction in dollars that I'm receiving here, that reduction in dollars will also mean that I have less money now to get the newest nursing graduate. I have less money now to get the top surgeons and everything to come to my facility because I'm struggling now because my income has also been reduced as a healthcare facility.
So that affects your equipment too, because now I can't
That also-
afford high-tech equipment
There you go.
to stay ahead. And then they pull money from a lot of experimental drugs and things of that magnitude. So there's no research to further what we already use, and we couldn't afford it anyway because now we fight for our
Exactly.
life. And we got to cut down on personnel. So now the wait time
Yeah.
between doctors and administration is going to be god awful because
Yeah.
there's no more 10 people doing it. There's 5.
Exactly.
It's the amount of healthcare, it's the access to healthcare, it's the, I don't know, this is something I think people already saw, but it's the prohibition of any federal funding for facilities that don't qualify. And like the list of facilities that don't qualify are basically any facility that does family planning. It just does not qualify for any federal
Yep.
funding. So there's that part too. Obviously, no gender affirming care.
Oh, they hate you. They hate them.
Oh,
So
absolutely.
they absolutely hate them.
Absolutely. Some of the benefits that were extended to pharmacies too, because that extends to again, family planning and gender affirmation care. So all of those are also happening. There's one more piece of this that's important too, and it's SNAP.
Mhm.
So it's like the food nutrition programs. And I know that they eliminated the National Education and Obesity Prevention Program, which was tied to SNAP. They've reduced the reimbursement rate for SNAP from 50% to 25%. It's not going to start until fiscal year 27, which I think is so interesting because it means that by the time I think we feel it, at least on the SNAP piece, he'll be at the end of his, essentially at the end of his term.
Everything is intentional.
Everything is intentional.
All these budget cuts, everything that you just mentioned, the fact that these bills run out in 10 years, it's all intended to hit when the next administration or the next,
especially if he's a Democrat. It's like, oh, they did it. And nobody's going to think about by then. We have short-term memory.
The monopoly effect of this is interesting though, because SNAP, like think about all the other programs or supports or services that exist that people may have access to, right? Whether it's at school, like elementary school, college, or even like a training vocational program or community college programs where SNAP is a criteria. Like if you qualify for SNAP, you qualify for this, right? But so many fewer people will have SNAP, will have access to it now.
Which means you don't
qualify for anything else.
Yeah.
Essentially changes the floor, the poverty floor.
Well, okay, so for people that think this is a joke, and I heard this, and I don't think people heard this. So recently, Secretary of Agriculture Brooke Rollins, who was the head of the U.S. Department of Agriculture, suggested that individuals on Medicaid who are considered able-bodied, which we just talked about the people that are on Medicaid, could potentially fill some of the roles currently held by immigrant farm workers. So the thought process is that the people that were getting Medicaid can work in fields.
Again,
so
let's go back to who's on Medicaid.
Who's on?
For those that thought it was a joke,
we called it.
Junior, who's 10 years old, who's on Peach Care. See, what they do is they hide the name of what, like Tennessee Care, Peach Care, Georgia Health something. Yeah. The marketing team is phenomenal. They'll change the name of something, but the funding comes from
the government.
From the government. Yes. And so if the program is intended solely for those who are disabled, those who are elderly, and those who are children, who are these able-bodied individuals that are finding their way to get onto to Peach Care?
And clearly signing up to go work in the field.
And going to sign up to work in the field.
So for those of you that thought didn't realize what they were doing, that's the thought process. We're going to get rid of all the immigrants. And when everybody's going, well, who's going to replace them?
They're taking their job.
You on Medicaid, little Takim, that 7-year-old Takim,
because they're taking their job.
And a strawberry bag.
We talked about this.
Because the thought process is like,
not my baby. My baby's selling waters.
Oh, Waterboy. The Waterboy's next. They go for Waterboys next.
At the same time, we have to remember, so the other side of this bill, right, which is who benefited, right? So the tax cuts, the extension of those tax cuts. So it is maybe the largest increase in the estate tax exemption. When I used to practice, when I was a personal financial planner and I did a lot of tax planning, the threshold was $4 million. That was your estate tax exemption. So you could pass that much without having to pay any taxes. So that is now, and will it be in 2026, $15 million that can pass, indexed to inflation, as they claim. They raised the standard deduction. They have lowered, certain tax brackets, not in an equitable way, not in a flat way. They've also increased the bonus depreciation deductions, full expenses for any business investments, and they've permanently lowered the corporate tax rate. So that temporary tax rate deduction from 2017 is now permanent for business owners.
I don't know what it would take to break up the MAGA foundation, that the people who are going to be highly affected are still going, yeah. I don't understand what it's going to take. The man literally told y'all, I'm going to decrease the deficit and just increase it again for no good reason. That's not even going to affect you, Trailer Park Judy. It's not even going to affect you. It's for his friends over here. Richie Lane is now having the field day at the end of the day. I don't get it. I'm confused.
What confuses you about this?
I'm
confuses
confused.
The half the U.S. population doesn't even read on an 8th grade level. You're an educator. You know this.
I was trying not to look at the obvious.
Yeah. No, you're talking about words like deficit. Have them define it. If they can't define it. So when these politicians are very good at
spinning narratives,
and putting things out there and telling you to look at one thing while they do something else completely on the side there. I think now if you follow the social media trends, they are waking up to see that, this big, beautiful bill didn't have my tax cuts that I was promised, or the no tax on tips that I was promised, or the no tax on overtime that I was promised.
They got them good on that one.
It didn't. They were so focused on they're taking our jobs that when they did finally remove them, they're like, there's no one to do said job. Yeah, I don't think that we are we are definitely an F around and find out type
Literally,
of,
like-
Absolutely.
of state. So
It's going to be interesting trying to watch states. It's not. That's a lie. It's going to be horrible. Trying to watch states navigate eligibility checks from every year to every 6 months for some of these programs. Like even we enroll people regularly in some of these programs and through my job, and that can take 2-3 months. And it only has to be reassessed every year. So to think that they have to reassess it every 6 months and that it takes 3 months. Who's going to work? And who's going to work these jobs? Who's going to work these government
with
jobs?
less staff. Let's not forget, there's
Like,
going to be
it's
less staff,
insane.
more work, less staff for people who are already overextended. Like, that's not. Keep in mind that mental health. So now it's like I went from having 30 co-workers to 10, and the 10 of us have to meet these quotas every other day. Like the mental health in that piece, it's gonna be jumping out of windows and jumping off buildings. It's
yeah.
Turn the window, baby. Turn the window.
It's
overdosing
ridiculous.
on pills and
Ain't
stuff.
nobody opening up no pills.
Okay, so let me
We
ask
gonna
this.
barbecue over here. I don't know.
I know we still gonna be doing boots on the ground.
Exactly.
You know,
Still,
and I look at us. I'm like, do
I've
y'all
learned
know
like
what's-
4 line dances during this administration. So, whoa. I'm
That was playing in my head before he even sung it.
I'm just
Y'all
saying.
not putting that in my head. I need that.
I have
out.
learned like 4
Same.
line
I
dances.
need that out.
As the world burns, I'm gonna learn a line dance. I'm not stressing. You're not stressing me out. You're not stressing me out. I don't care.
I mean, we won't be, but
Don't
what
care.
is that going to look like at the family reunion in another year or two when they can't afford the family reunion fees to take care of the barbecue? Like, what is that going to look like?
The our population we are survivors.
Yeah,
We've
like roaches.
survived everything, and we will survive this. The reason that we are not up in arms, and Simone, you better not be out
It's
there
important.
protesting.
It's
You better
important.
sit your ass at home.
She tried to drag me out there, so yeah,
I'ma
she absolutely
pop you in
is.
the
We
back
got
of your
some, we
neck.
got some more
She
ideas.
absolutely
I'ma pop
We got
is
some
out
more
here
back of your neck.
ideas.
protesting.
Let's talk. Let's
down.
talk.
I think we as a people that we have that survival instinct, and things that shake other populations they don't shake us. You can't shake me by turning my water off. I got a gallon of water.
Or I go next
You
door.
know,
Like, we
right?
close.
I
Me
go
and my
next
neighbor,
door.
we
What you
close.
talking about? Pull a bleach in that toilet. You got to flush everything. So you're not shaking me because I've already been there. That doesn't bother me. I'm not committing suicide. We gonna have a fish fry, and we gonna sell stuff within the community. We go to a bartering system if we need to. You do my hair, I'll cut your lawn. That is just what we do as a people.
That's
So we will continue to be unbothered and unmoved and unshakable. Hey, shut up.
Okay, Bishop.
Okay.
And it's real. It's real. Amen. It's real. We talked about, so we had an incredible guest here recently as well who was talking to us about First Amendment free speech.
Yeah, so she's all in power because now she understands the process to have a protest and all that stuff. Which she
We
probably
do it
knew
all
anyway,
the
but
we do it all the
she probably knew all the time.
But I don't understand. It's different everywhere, right? And the process is different everywhere. I do a lot of work out of state and in New York and in California. And in Georgia in particular, I know there's a permit process. I know kind of how that goes. But she's dealing with so much of the litigation on the front end, like these big sweeping lawsuits, the censorship, the book bans, all that stuff. So we were talking about, what you can and can't do, like best practices. We considered a few things: busing, vanning.
No.
We were talking
We're not
through.
going to say we. We're going to
Ricardo
say
and myself,
because
you
that
know,
particular
how we
day,
can-
Simone was feeling gangster, so she was like, "We should let all those kids from Job Corps. We should bus them over to the elite communities and drop them off so they can loot and pillage in those communities."
I mean,
Our
that
babies
was
are
not
what are we
gonna
going to do
loot and
without Job
pillage.
Corps?
that was her idea.
Come
We're not
on
gonna-
now.
we're not
What's
going
wrong
to
with
say
Job? What are we going to do without
pillage.
Job Corps?
we're not going to say we.
So let's move. So the reason I wanted to bring this up is because free
You're supposed to
speech
go work in the farms.
is important.
Literally, I don't know why she didn't see that. Like they're supposed
What
to
do you-
go
I hope
pick
they rob.
strawberries.
I hope
They're
they
supposed
rob
to-
every single
I
one
do
of them.
too.
I hope they do.
I do too. And then they have boots on the ground playing in the background as they're doing it.
Period.
Y'all want to start the purge. I'm not with it. Y'all want to start a reverse
We didn't
purge.
start
I'm
it.
not with it.
I didn't
we
I'm
didn't
not.
start it.
We're trying to avoid a civil war.
Too late.
We're trying to avoid
Too late.
that. You two are
That's what I
ready to
believe this
burn it all
is.
down and sit there like Nero and just pee on the city. I'm not.
The way
I'm not
Past
with it.
this point,
the
Ricardo.
way
not
that
with
I
it.
believe in my amendments and having my firearms,
Let me tell you something.
I got
we
it on
all
me now
believe.
because you never know, Shawty. You never know.
We all
You let me
believe.
tell you something.
I'm
ready.
not doing this with
Boots
y'all.
on the ground.
I'm not doing this with y'all.
Public media. I don't know how people are feeling about this. I think this is important for lots of reasons. So $1 billion plus has been stripped. Congress has voted to strip it from public media, in particular from NPR and from PBS. There was a lot of reporting over the past couple of days that have talked about how old this effort is and how like Reagan and George H. and George W. and Newt Gingrich had all tried to, Bob Dole tried at one point to strip funding from these entities. So, but for 5 decades, Republicans have failed to get rid of federal funding of it. And some of them were afraid at the time of being accused of, killing Big Bird and Sesame Street, because these were household staples for decades, frankly. But the party always stopped just short of stripping funding, and now we've been successful. So do we have thoughts?
I guess my takeaway is these things are not as near and dear to us as they were. Like Sesame Street, I don't even think Sesame Street is even with that space. I think Sesame Street got moved to HBO Max. So I think they just signed a whole new contract because HBO Max was like, nah, we're not about to let Big Bird go under. So we're going to take it. We're going to take your old episodes and let you create new ones. That's one of the few things I remember from PBS. And most kids are getting, especially black kids, are getting Gracie's Corners and other stuff. So I don't know if that's as near and dear as it used to be. And even with NPR, like, I feel like only older people watch NPR outside of Tiny Desk.
No, for sure. What people have to remember, though, is the local stations, like that the funds flow down through. That's where a lot of this goes.
WOAK?
Versus WOAK, I can check on that one in particular.
I think that might.
But that's where a lot of the funding
WOAK.
is. It's not just with NPR or with PBS.
I get that, and I hear the concern because, of course, our First Amendment rights. But I think, and I agree that because we are in a different space and time now with social media, and streaming services, and how we as an American population or a global population actually consumes information, it is now pivoted. So those particular entities were important to our grandparents and their parents because that's how information was disseminated. Now, and this is even with the privately owned public networks, this particular generation or generations plural, they've shifted the way they consume that type of media. So when they are attacked, like the late night show, or Joy Reid when they canceled her show, she was able to pivot quickly and just go to social media. She already had a follow.
We were waiting for you to go to your own space anyway. So.
In my household, I stopped watching MSNBC as soon as he went down. Those two went down to go kiss the ring with to 45 or 47, whatever his name is now.
I don't care.
I forgot. Anyway, that's slow. Oh my God. I said it on live, didn't I?
Yes.
Yeah, I don't care. But I pivoted to watching getting my news from Reels and from TikToks and from entities like you, the podcasts, et cetera, that I can actually trust the information that's coming from those individuals.
So we're talking about an erosion of trust with these public stations. I mean, I understand a decline in interest. I understand a change in audience,
but I was maybe leaning the erosion of trust from the
more like MSNBCs. Okay,
yeah,
okay.
Yeah.
Fair, very fair. The African American Radio Consortium gets 30% of its funding from the federal government. So all of especially of the Black-owned radio stations.
I mean, but again,
that's a huge. It
is, but again,
and I do agree that our consumption has changed. I don't know if that's necessarily good.
Well, that's the fear
because that's right. Because if we're getting our news from TikTok, Now, if you already have a solid basis in education, that's one thing. Everybody may need to be listening, though. That's the thing.
When the last time you turned your radio on?
We was listening to radio on the way here.
You were live.
Radio and
you ain't got the live,
Craig. He's actually here, so I can look to my right and ask.
Exactly. Were y'all listening to the radio? She said you a damn lie. You a damn lie. You wasn't listening to no doggone radio on the way here.
Y'all listen to like the radio, like regular radio.
Yes.
Girl, mind your business. What about talking to you in the first place?
Regular radio.
You want to listen to no doggone radio.
Praise. Right now,
y'all one of the few because I can take the last.
There's 4 people listening to the radio.
Here's the thing.
There are 4 people.
There are 4 people.
And 2 of y'all in the car together, so it only counts as 1. Don't lie.
Are we better off though? Are we better off?
Look, do you see on the right side of your emblem has all these different streaming services? You sit up here, blasphemy. I don't see W whatever on
but
there.
I will agree with you on this. So like my worry is that if we do eliminate those things which are at our foundation, whether we listen or not, at the foundation, we're trusted in their timestamp. But
when's the last time you picked up a newspaper? Right.
I don't think they're really available anymore.
Exactly.
Honestly, I used to read
Right.
USA
They
Today.
are available.
Move on.
USA
I read
Today
them
too?
too.
Move
No,
on.
the Marietta Daily Journal.
I don't read it.
Here's the problem though. If you so say this all goes away, right? And say little Timmy needs to look up how many hospitals are in the state of Georgia. He can't go to TikTok for that.
Well, you still got Google.
There's not a single
But
influencer
they
that
know
can help with
Google.
that.
You could still.
You
What if
still
he
have
needs to
Google.
figure out how they operate or how they run?
Well,
Or what
let's-
if he needs
but let's not
to
forget-
pull reports? What
But
if he
let's
needs to pull
not forget.
reports?
You
Well,
can
who
still
will make him do? I'm a teacher.
reports.
Who's making
But
him
you
do
can't
it?
get that from social media. You gotta use basic internet.
You can use the basic internet. Yes, that's fine.
Google.
And the podcasts that we love the most that actually do their work, they cite actual stations.
I'm not okay.
and
Sure.
actual publications.
We're already in.
Sure.
Look, the reality is. The reality is, even top tier cable networks are having to figure out how to compete with streaming. So it's not
That's
like
true.
we're not having to shift that way anyway. This just kind of pushes it.
I
Black
know.
folks are gonna have to do what black folks do
I know.
and find our safe spaces and the outlets that we trust, which most of them were already doing it anyway. Really, the only people still listening to analog radio are people in the rural. Like my mom and them still listen to 97.9. Why?
Mhm.
Because they don't really understand streaming and things that magnitude, so they still listen to 97.9.
Simone, you better make everything from scratch.
is gonna have to
You
figure
better
out.
you make everything from scratch. You better make everything from scratch.
not
You better make
everything.
everything. I don't want to hear it. You better make everything from scratch.
I mean, again,
I will spit out this
Biscuits.
cake. Is this box cake?
Biscuits.
I will spit.
Biscuits.
They were
You better
already
make
gonna
everything
have
from
to
scratch.
shift. They were already gonna have to figure out how to shift anyway. They just
As
made
much
it
as you
happen.
are
Let's understand,
preaching
let's
right
understand.
now.
But is it not a public service?
What?
Our library is not
Yes,
a public
it is.
service.
It-
Are they
libraries
not
are
publicly
public service.
important?
Let's be honest.
What about for unhoused populations?
How much longer do you think libraries are gonna last? How much longer?
But what I'm saying
Unless
is these
a
are all
private
awful
entity
things.
steps in.
What I'm saying is these are all
We're not
awful
saying
things.
that they're
we grew up
There
awful.
should
on it.
be
We're not saying
free
they're not
public access to,
awful.
but you're incredibly casual about it.
Because it's
The
coming.
extermination of the entire.
It's coming. Unless you know somebody rich that's willing to go fund a
And
lot
she
of
said-
libraries.
or we know
it's
somebody with
coming.
some aim.
She said
That's the problem.
extermination.
No one can aim, or we would be here.
See,
We
this
would
is what I'm
be
talking
here.
about. I didn't say
don't even know what
aim,
that means.
though. I said die
I
slow.
told you she been
But
wilding
she
out.
said
She's
aim.
been wilding out. So your
This
your
is
secondary default is violence. I'm very concerned
See, I
about
love
that.
it. I
Go
love
ahead.
it. I love it. I love
Okay,
it.
and reality, even with the Stephen thing,
This is the only light
being
skin I ride
canceled,
with.
Even with him being canceled, late night TV was eventually going to go away anyway because, again, who's watching it?
Well, I can't stay up that late. It don't-
Well, that's concerned. I do,
I'll be
but I'm not.
sleeping.
I'm probably watching Bob's Burgers. I'm not turning into
Not
any of those
Bob's
boys at late
Burgers.
night. And it's expensive to do.
Sure.
Cable networks are coming up now. It's like, okay, well, if it's expensive to do, even with ratings, it's not feasible for our bottom line. Late night was eventually not going to be feasible for the bottom line because nobody's really watching, and then it's expensive to do. You got a live band, you got the stages, you got the live audience. It's expensive to do. That was bound to happen.
Mhm.
So when it happens, I'm just like, now, had they gotten rid of all three of them at the same time, then I'd be like, yeah, they might be trying to silence them because they be talking out against Trump. This is eventually
That
coming, and it's
principle-
not happening
nothing
tomorrow.
about that principle. Nothing principally wrong with that. No.
I mean, I'm not saying.
There's
I mean,
thing-
we're
not
definitely
saying there's nothing principally
Yeah,
wrong
we're
with
not
that.
saying that we're not under attack. We're just
Sojourner.
saying
Okay.
it's not as in that space.
Sojourner
it's not
Truth
as
over here. Baby, she...
We're not saying these things are not god awful, but we're also saying at this point in this walk, we have got to be realistic about what they want,
At this
what
point
is
in this walk.
targeted, and what's coming down the pipeline. And all of those things were eventually coming anyway.
Yeah.
So we just got there earlier. Okay, well, Black folks going to adapt. So, this is what it is.
Mhm.
I eventually figured that in the
I
rural
love it.
areas that's still listening to
I love it.
97.9,
She's really with that
Yeah.
they'll
girl
have a
good.
cookout and they'll fund their radio stations. Fish fries, car washes, they'll fund their radio stations.
GoFundMe's.
GoFundMe's, they'll fund their radio stations.
It's just not giving great again. It's not giving great again.
Yeah, I
thought we were trying to move backwards here.
I know you didn't just figure this out. I know you didn't just figure this out.
It's just not giving great.
I know you
again.
didn't just figure this
That's
out.
all.
When
That's
was it
all.
again? When was this
When
again?
late night was a staple of American television, when Sesame Street was a staple of our childhood,
Well, Sesame Street's
when
not going
Huckleberry
anywhere.
Finn was a required book
What we're not going to do. Huckleberry Finn was forced
and not
reading.
banned. It was forced.
Wait, it was
reading.
forced reading. And at that time, that was cute. Now, I will say that some things that Sarah said last time we was here from the ACLU about how books create empathy did stick with me. because I'm a teacher. So I'm like,
They
if
do.
these kids don't read the Diary of Annie Frank or things to get another
Not Annie.
aspect. I love Annie.
Not Annie
That
Frank.
book beneath the floor. And
Not
she would
Annie
look
Frank.
for it.
Baby,
And
Annie.
that
She
that
became
journal.
Annie
That's
I
a
love
black
it.
woman
I love
story
it.
now. Annie Frank.
God.
If they're not reading those books,
The Diary
there's no
of
level
Anime Frank.
But shut up,
Oh,
Bush.
sorry about that. Okay.
They're not getting that empathy factor that is needed.
Oh,
and,
Lord.
You know,
No.
people have this society that just has no empathy for anybody. So
Or
killing
literacy.
and genocide will become more of a possibility because nobody has any empathy anymore. That did concern me. That did stick with me when she said that because I was like,
I'm glad something
you don't-
concerns us still.
But I think
It's
that's the that then forces the hand of the parents then to fill in that gap.
We really want to talk about this?
Well, I'm just saying.
We really
I know
won't
you.
talk
I
about
know you're
this.
an educator. I
Yes, I was gonna
understand.
say, yes,
We really won't
educator.
talk
How
about
do
My
you feel
mama
about
made
that?
me read, so
I mean,
I
all
don't.
of our parents made us read,
Yeah,
but that's
that's
not
true.
the case these days.
Okay.
Anymore.
I barely get. There were kids last school year. I have never met their parents. Never. I had your kid for 10 months.
And you wouldn't have met mine either.
Oh,
My
you
mama
met
wasn't coming
mine.
up there.
Yeah, mine was
You'd
very
met
busy.
my
My
mom
mama
was
wasn't coming
coming.
up there because if she was coming up there, she was gonna slap the shit out of you.
Yeah, why did I have to come up
But
there?
I'm sure she interacted with the teacher
No.
at some point. So
If she was gonna interact, she was gonna slap the teacher too. She
well,
wasn't
yeah,
coming
your
up
parents
there.
should stay home because
Yeah.
I stay strapped. To
Exactly.
So hands start
Exactly.
flying, so are bullets.
But that didn't mean just because she wasn't physically in the building didn't mean that she didn't care about my education. So I was still required to do summer readings. But reading was a part of my punishment. If you don't know a word, go look it up. What you do, go look that up. Go read that. That encyclopedia.
It has not been that long. Encyclopedia. It has
yeah,
not been that
Britannica,
long.
yeah.
that- ooh,
We
that
only
was-
had the first set, so I could only go to F. She didn't get the full kind because we didn't pay them people. So
But that was reflective in your scores. When you have kids, that
Yes.
it's reflective that nothing's being done at home and you're reaching out and there's no reaching back.
I completely
This is-
understand.
this is
but
where we're
but if
sitting.
we're talking about what we need to do as a community to combat this, then that means we are going to need. If they're taking Huckleberry Finn and Diary of Anime Frank, if they're taking these things out of the school system, then we there's no choice but to infuse these into our homes. So that means you have to add the literature, even if you don't read it yourself with your ignorant ass. At least make your kids do it. Cause my mama sure wasn't gonna read it, but she wanted me to read it.
Yeah, make sure I read it too.
Right. So if it is up to us to actually infuse that into the actual community as a whole. It's just one of the plans of action.
I don't.
It's true.
I don't feel safe trusting that to parents to infuse that in already decimated spaces. I can't even get you to put your child on iReady, which is a computer program.
That's fine.
For 20 minutes.
You may not, but this is where we need to go back to the community-based model that we grew up on, and that was the foundation of our community. We need to go back to the community.
Yeah, but don't we need a full family to do that? Uncles, aunts, grandparents. Half of them not even talking to each other.
But we've always had extended families and those things. You've always been uncle to somebody. You've always been auntie to someone. My little baby nephew, when it's time for toys, he gets a toy, but he always gets books from me too, because my baby ain't gonna be ignorant. She little dumb ass. I'm not gonna. I don't operate like that. Okay,
Well, I should hope not. You're a college professor, and you're a doctor.
I don't
would
care.
think that.
But you gotta also be able to see. Y'all need to go back to calling kids stupid and embarrassing them in public.
Yeah, that really worked well for us. We're not traumatized as adults.
Well,
Look at you. Aren't you a doctor?
Right.
With your stupid ass. She did good.
Again,
She did
actually,
wonderful.
my parents did not.
I'm
My
great.
parents didn't do that. I'm
You
from
go.
country.
You sit your dumb ass down. It wonderful. I'm a doctor today.
No, that's one thing I can live without. I hate when they do
You
that.
got whooped.
I can
Right?
live. Now that I'm
Corporal
fine with.
punishment.
I'm
Didn't
fine
they
with
beat
that.
you into
'Cause it
success?
worked.
I'm fine with
Did
the
it not
Did she
work?
not
beating
beat
part.
you
It
into
worked.
success?
Did it not work?
Right.
I'm not doing this with y'all.
Slapped
just
you right
saying.
across that
Smacked
stage.
you. It worked.
Look
I'm
at
not
you.
doing this with
Wonderful.
y'all.
Paying
I'm
your
not doing this with
taxes.
y'all. All right, so
In fact, when they stopped spanking, I think that's when we saw the immediate
Exactly.
decline. Immediate.
are we really gonna have this conversation about spanking and times out?
Next
Time out?
time.
Beat they ass.
All right, so I have one final question for you.
Yes, of
Can
course.
you focus? Can
Absolutely.
you focus?
No.
So what about those individuals that say, well, I'm not on Medicaid, so it won't affect me? So outside of longer waits and things of that magnitude, how else will it affect people who are not on Medicaid?
You should probably think about the implications it has for your family. Think about the typically, of course, our community doesn't normally do nursing homes, but there are patients or parents that you just can't care for at home. Those have to actually go to a nursing center, or if you have a patient with a relative with a disability or a severe disability. Typically, those things are covered by Medicaid. That nursing home is covered by Medicaid, right? So those things, those dollars will be coming out of your pocket. So instead of Medicaid covering 100% of that, maybe they only cover 50% of that. Well, if you work in healthcare, you know that some of these services are $20,000, $30,000, $40,000.
Are they? I've never actually sat around thinking about how much a nursing home costs.
They're extremely expensive. That's why it's a business. It's extremely expensive. So those the care that's being rendered for your loved one. So you're going to now have to take more ownership in that. This goes back to community model. So we need to, of course, come back as a community to help take care of Mima, even though she's throwing shit at you.
I said focus. I said focus. I said focus.
Can I curse on your podcast?
You already been doing it, so what difference does it make?
Shit, my bad.
Bush, finish your thought.
Yes. So it has those particular implications. So making sure that we're not just thinking about ourselves. Yes, currently you may not need these particular services, but in the near and dear future, you will. Also think about the time frame. This is a 10-year kind of countdown. What's happening in 10 years? Well, in 10 years, your parents will be the recipients of these particular services. They may not be recipients of it currently. They may still be working, but they're close to retirement. By that point, they should have already retired and well into their retirement age. Are they still going to have to work for health coverage and health insurance? Will they be able to afford the gap that the state doesn't come up with, right? So you have to think about it in that manner. And while you may not care about those other people, your mom or your dad might be on that, or your aunt, your auntie or whoever might be on those particular services, or should I say not be on those particular services. And so now you over here with 7-Up and rubbing her salve on her chest because y'all ain't got no
joke.
Who was 7-Up?
You a little 7-Up, a little ginger ale, and go lay down and get that right on out your chest. You
make me sick.
No?
You literally make me sick.
I hope not, because you ain't got no coverage.
So is there are there any drastic measures that the state may start to take to help fill these gaps? Like raising taxes or any?
Probably not, because obviously we share the state with all our counterparts with every race. So typically raises in taxes are not a popular thing for any party, Republican or Democrat. What I probably will see is what Simone, of course, mentioned earlier, more barriers to access, raising the requirements, a rejection of applications to both Medicare and Medicaid for simple things. They could probably see lots of things in that. Reimbursement rates, obviously being a thing or a factor, could also be an issue that happens there. Or funding completely to certain programs could be just cut off completely. So what probably needs to happen, because most Americans don't have the money to handle an emergency, a medical emergency. Typical medical emergency is about $5,000. Most Americans only have about $1,000 in their savings account. Okay, some of y'all only got $8.
Yeah, it's really street.
That overdraft fee, it be killing you, don't it? But you can get $300 into your payday. Not saying that life is different now. I got it now. I used to didn't have it, and what you do is you take that money out on Wednesday night because your check gonna hit Friday.
I mean, it depends on your bank, because if it should happen, Chase doesn't.
Well, I can't bank with Chase no more. But anyway, it was before I was Dr. Bush. Anywho, but start thinking about long-term or long-range planning. What does 10 years look like for my parents? Mm-hmm. What does that look like if I do have a disabled individual in my family? How am I going to get them the services that they need? So start maybe looking at more of the charitable opportunities that are out there, or the grants or the fundings that could take, some of that weight off of your shoulders as you are getting to that area. And maybe as your parents are getting older, putting money aside for their care, because again, while we are known for having our parents live with us, and being in that room, and you kind of lock that door, because that's what I plan on doing. Gwen, baby, you get locked in the basement, boo. That's what we are known to do. You also need to think about, well, how am I going to fund a nurse or a nursing assistant to come to the house if Medicaid or Medicare doesn't cover this 100%, or the amount that it currently does now?
So the dying question is: are we screwed?
You've always been screwed.
No. No.
You've always been screwed. What do you mean?
No.
To the max.
No,
Like, to the max.
As a people, we're always
Thank
good.
you.
I firmly believe that we are survivors, and that we are known, of course, to find ways out of no ways. Always. Again, we have a tendency to put our boots on the ground.
Do not start singing that
It's called
song.
a callback. You got to call back. Okay. We are going to be all right in this, regardless of what's happening there. We don't care about credit because we never had it. So we don't. Yeah, we're gonna always, of course, be okay in this instance. Whenever my family will take the mold off the bread and make a bread pudding. I mean,
That's actually safe. That's
yeah.
all right. That's all right.
What's safe?
I think we're
To cut
fine.
the mold off.
Yeah, cut that mold off, make a bread pudding. What are you talking about? Don't throw that chicken out. We're gonna have some chicken salad. Like we're fine. We're fine. We'll just make ways as we always do.
All right, final thought.
I need to learn some more line dances.
You've learned 4. I think
I
you're
know.
good for any cookout you go to.
I know.
You've learned 4.
No, but I'm learning like trail ride. When I got to learn a trail ride, I just got the I can't get enough of you, the Tamia one. That was like 7,000 steps. I just got that one.
It's a lot of steps. I love it.
It's
Though.
about
I don't
7,000
actually understand what that dance is. It's
I don't
like
care.
scooting back,
Let's do it
scooting
after.
around,
Let's do it
scooting.
after.
I don't care. I'm gonna do them all.
Give a reputable final thought. What are you doing
That
now?
was, look,
Really?
go ahead.
Learn more line dances.
Go ahead.
Learn in this time. Okay. Final thought.
Mm-hmm.
Final thought. Start consuming more reputable. Find your reputable podcast or news source, as the news outlets, of course, are being decimated. Start saving if you can. Get your permits.
If you can.
If you can. If you
Your
can.
advice is terrible.
Okay. And if you can't, still get it.
Would you not encourage that? I feel like I should have put that disclaimer. The
What?
thoughts and opinions and ideas of guests are not necessarily shared beliefs of the Leadership in Live podcast.
Okay,
And then learn, of course, some line dances.
Yeah,
Simone.
absolutely. I appreciate your final thought that we, as a community, I know we will be okay. I know we will. So I appreciate.
What are the hand motions? What is happening right now?
You know,
I'm not letting you two sit beside each other
ultimately,
again.
I
Y'all not
appreciate
beside
that. I
each other
appreciate that
again.
reminder. I do.
It'll be
It's an
fine.
important one. And
Vote
we can continue to
locally.
strategize in the meantime. You know,
Yeah, strategize. Spades, baby. It's spades. Y'all gotta learn how to play spades.
You
Stop
know?
playing.
Ah,
This is why they never had me back.
this is very.
This is
you
why.
said
I'm so
he-
happy to have
you
you
said he
back.
wows out. This is exactly why he comes like once every year, because he wows out.
They
But
don't ever have me
he does
back.
have to.
I feel like I'm not gonna see y'all again now.
No, actually, we'll start calling you for other stuff. We
Yeah,
won't even
never
bitch for
mind, no
healthcare.
more.
Just if we want an extra person just to shoot around what we're talking about. So you've been
I expect-
upgraded. So now you get
I
to come and
expect
be
a home cooked meal from
correspondent.
Simone the next time that I come back.
I got you,
Listen,
baby.
that's not
Because
happening because I've been with this chick for like
I got
6
you,
years.
baby.
and
Everything-
she's never cooked for me.
Everything from scratch.
well, it's not. We're not.
She's
gonna do
never
that.
cooked for me, so
We
that's
can,
not
we can
happening.
get right all at once.
I don't even know. Can you cook?
Yes, I can cook.
She light skinned. She can't
I cook in my
cook.
home. I cook in my home.
She can't cook.
I cook in my home.
She can't cook.
I
No, she
sure
can't.
do, don't I?
lie.
That's
You
what I
already
said.
lied
P
for
is
her
here,
already.
so it's-
Don't
My
do
wife
that.
will.
P is here,
my
so
wife
it's
will.
fine.
Amen.
After this is over
Your
with.
She'll tell
wife
the
is
truth. She'll tell the
skinny. I don't
truth.
trust.
She tell the truth. She tell the
No.
truth. Oh no, she not.
I don't. How
Just
do you
get
get
it.
She'll tell the truth.
Okay, in any event. All right, so we want to say special thanks to Dr. J.
It's a
Bush for
pleasure.
into the
Thank you
show.
so
Thanks
much.
for coming.
Thank you so
As
much.
always, a good time. I'm going to have to put a disclaimer about all the cussing you did, but it's fine.
Yes.
I mean, it's fine.
No, you ain't
even
cussed
have-
that
it's fine.
goddamn much.
It's
Now,
fine. We will see you next time, same place, on the Leadership in Live podcast with your host, Ricardo Rice, and my co-host,
Simone Cherie.